FRAXEL was manufactured and launched in 2003. The idea of FRAXEL was to allow more people to have a resurfacing treatment without the downtime of the normal and original ablative lasers. The FRAXEL laser has two wavelengths, 1550 and 1927. Both wavelengths are looking for water. The 1550 nanometer wavelength is actually penetrating deeper into the dermis, and therefore it's looking for indications like acne scarring, surgical scars, stretch marks, and plumping up lines and wrinkles. The 1927 is working on the superficial layers of the skin and is really more interested in removing pigmentation. So this helps with sunspots, liver spots, freckles. The FRAXEL has two tips. 15mm tip, which is actually used for the face and the body and is the routine tip to use. And then there's a smaller tip, which is 7mm, and this is for smaller areas. Maybe you would treat around the eye area or the lips, or maybe just one single acne scar that didn't require something very, very large. The tips are disposable and each tip will have a life. And so on average, you can actually treat 4 to 5 faces with one tip. FRAXEL is high-tech. There's a lot of research behind it. Doctors and nurses in the main use this. There are some doctors who actually delegate these tasks to their therapists because it is a simple device to actually use. One of the unique things about FRAXEL is that you can actually apply it anywhere on the body. So you can use it on the face, the arms, the legs, and it's safe. The benefits of FRAXEL to the patient are the technology. It's proven. It can actually be applied anywhere on the face or the body. There's very little downtime. You actually are treating a percentage of the skin each time you see the patient, and so they recover quite quickly. And we would repeat the treatments in 3 to 4 weeks' time. When you have a FRAXEL, the benefits to the practice are many. Again, we have celebrity endorsement like the Kardashians. It's very versatile, and so you can use it anywhere on the body, wherever there's skin. You can use it on all skin types, so that's skin type 1 to 6, which is white skin through to African skin, without any problems. The amount of treatments that are required will depend on the patient and the condition that you're actually trying to treat. And so if we actually look at, for example, the reason why FRAXEL was actually invented, it was to actually give the patient the opportunity to have an aggressive treatment but given over a period of time. A patient should have 4 to 5 treatments, which would mean that you're going to treat 20 to 25% of the skin at each treatment episode. Of course, this can be slowed down, or it could be actually speeded up if the patient has a time issue. FRAXEL actually is a very good device on its own and can treat many things. But we like to treat people with combination therapy today. And so, for example, if you had treated somebody on the thermage, on their face for lines and wrinkles, it can take 6 months to see the results. And it would be beneficial for the patient to have some FRAXEL treatments so you could improve the fine lines and texture of the skin whilst the patient was waiting for the thermage to kick in. Equally, if the patient had had fat removal with liposonics, then you would actually improve the stretch marks that the patient may have on their skin.